This video looks at the effects of tandem walking while using strobe eyewear. Trial 1 is no eyewear while walking, immediately followed by Trial 2 with the strobe eyewear at the level 3 setting, and finally Trial 3 is a retest of Trial 1. Immediately we can see the difference with his balance between Trial 1 and Trial 2 when he is walking forward. He has more body movement in the frontal plane while wearing the strobe eyewear. The difference when walking forward between Trial 1 and Trial 3 is his turnover rate. The increased turnover rate produces a faster gait speed for Trial 3. After he walked forward for 20 feet, he walked backward to where he started. We can see the same difference with balance between Trial 1 and Trial 2. The same difference, increased turnover rate, is present with the backward tandem walking condition between Trial 1 and Trial 3 as observed with the forward walking condition. These three trials were videoed in succession with no more than 15 to 20 seconds rest between trials. A noticeable improvement from Trial 1 to Trial 3 was observed with balance and turnover rate for tandem walking. This occurred in a very short period of time. The improvements are very specific to knee replacement patients who are looking to regain functional independence after surgery, especially with walking. To maximize improvements, you have to go beyond your regular treatment approach.